I would really like to highlight the problems women have with the healthcare system, and especially the doctors. Uh, Not just uh, any woman, but yes, I think almost every woman, but especially women from the minority communities. And this is something that you will not find in textbooks. This is something that is not discussed, but it is practiced across the board when doctors, especially in government hospitals and maybe in some of the private setups also, when women come into the outpatient, a first look at them, and if they turn out to be women from the minority communities, the doctors have already made up their mind that these women deserve family planning services and nothing else really. And despite the fact that they are asked to sit through a consultation where she's talking about her health problems, there is a mindset of the doctors who are trying to figure out how many children she has, whether she should have a family planning operation, and whether she deserves any other services. There's also a kind of disgust that seen on their faces when the woman goes on very long. Now, why do women go on very long talking about their health issues? Most women have a tough life from the marginalized communities and from poor households where they take care of just not housework but childcare, taking care of older people, taking care of sick people, having sleepless nights if they have a small kid, having guests across, inadequate rations at home, and trying to cook food that will be um, go through the day. And this can be a source of stress and very, very tiring when other resources are so limited. Now, this exhaustion and confusion and absolute fatigue sets in, and when they're talking to the doctor, they're talking about their lives and the illnesses and the pains and aches that are associated with the lives. And medical doctors are trained in a very strange kind of way. The only thing they're looking out for is which organ is diseased. Is it a heart attack? Is it a gastritis? Is it a nerve pain? Is it a cough which takes them to the lungs? So they need to diagnose based on organs. Whereas women don't understand anatomy. Their whole bodies are raw. So they'll talk of back pain, they'll talk of headache, they'll talk of total nausea, sometimes vomiting, sometimes because of hunger and not eating properly, they would have all kind of symptoms. And this ends up in the doctor not really giving a diagnosis which women deserve. And in addition, their anxiety about family planning, and nothing else. So these are the kind of experiences which many women go through. The other problem was that during the time when family planning practices were at the peak, and in some places they are still there, that the doctors were willing to be taken to these camps to cut off the tubes, which are the fallopian tubes, which will stop women from getting pregnant. And hordes of doctors were willing to be deployed for something which is not an illness. Having patent tubes is not an illness. But the doctors never protested, the associations never raised a voice, and this country ended up with doctors who were de-skilled. They didn't know how to treat patients, but they knew how to cut tubes. So here is a country where everyone from the elite, the privileged backgrounds, participated in what was considered a national desirable program of family planning. In addition, now, when you look at the pandemic, what happens is that these very doctors and elite and others were there at the service of the privileged and the upper caste and upper class, where overnight they were allowed to get all their services sitting at home. Apart from online work, online learning, you had the Swiggies and the Zomatos and the various kind of services delivered at their doorstep. The big basket, small basket, every kind of basket was lying at their doorstep so that they did not have to contact the so-called suspicious populations which carried the virus. And today we know how untrue that is. Not just those services, they had regular incomes coming in, they had hope services provided by their partners at home, they had access to every kind of facilities in the public places where taps did not have to be contacted. You had water flowing out At the moment there was electronic sensors put in place, you had flushes working. But when it came to the poor, the marginalized, and the other uh, populations, they did not get anything that can be counted as a service from the state. They were left to their own resources with limited space. They, of course, could not be quarantined or isolated. Even 6 feet distancing was impossible. There were no incomes, they were thrown out of their jobs, and the fear made things worse. So, what did this population do? They started walking back home. Even if it meant that they knew they would die, they wanted to die in the midst of their loved ones. So, a country that has no policy, no plan put in place, surely there were people who could have sat together and worked out some plan for them. Whatever was worked out was doled out with absolute disgust to them, with anger, and very inadequate, whatever services that they had. Eventually, lakhs and lakhs of people migrated back home to stay with people who at least gave them comfort. The state could have provided comfort. The state could have, except 5 kilos of ration. And mind you, migrants are not registered anywhere. So even that 5 kilos of cereal was not available to them. So it is a statement about a healthcare system that doesn't recognize the problems with the lives of people. And a very small example that I'd like to raise is that when you sit in an outpatient and you have women from minority communities, the doctors do not want to publicly acknowledge that women from Muslim communities have much less cancer cervix and have a much better muscle mass, so that their and better cancers are much less among the minority communities because the men have been circumcised, and also with better muscle mass because they are eating flesh foods, etc. During labor, Muslim women seem to have better strength in their uteruses and abdominal walls, that there is a better outcome, that it is there for everyone to see. But then nothing is recorded, shared, or discussed. See, unless you discuss about the lives of patients, you're not going to spread this knowledge around. Now, I know of doctors who will say that, my God, the women are so thin, we need to give half the injection for anesthesia. But this knowledge is not shared. And why do they give half the injection? Because there is no muscle mass in women who are eating, who are vegetarians, who are living on pure cereal diets, that when you give injections for muscle relaxation, you need very little for the poor women, whereas women who are better built, have better muscle mass, require the standard international dose. But our doctors live on textbooks that are based on international experiences. We still do not have a textbook that talks about Indian experiences.